Breaking the Vicious Cycle. Intestinal Health Through Diet. Elaine Gottschall. Chapter 1. Past and Present. In 1951, after many years of clinical experience, Drs. Sidney V. and Merrill P. Haas published a book entitled Management of Celiac Disease. Directed to the medical community, the book documented the doctors' experiences in relating and curing hundreds of cases of celiac disease, as well as cases of cystic fibrosis of the pancreas. Their approach was dietary, and they used a well-balanced, normal diet that was highly specific as to the types of sugars and starches allowed. When patients followed this specific carbohydrate diet for a minimum of 1 year, they were then able to return to a normal diet with complete and permanent disappearance of symptoms. In 1958, we took our 8-year-old daughter to the Dr. Haas, 3 years before she had been diagnosed by specialists as having incurable ulcerative colitis, and her condition was deteriorating. The years of treatment with cortisone and sulfonamides, plus innumerable other medical approaches, had been unsuccessful, and surgery seemed imminent. The Dr. Haas placed her on the specific carbohydrate diet, and within 2 years she was free of symptoms. She returned to eating normally after another few years, and has remained in excellent health for over 20 years. Many students and friends, others whom I have seen in my practice who were suffering from ulcerative colitis, Crohn's disease, celiac disease, not cured by a gluten-free diet, diverticulitis, and various types of chronic diarrhea, have tried the Haas diet, and most of them are now free of their respective diseases. Some of the most dramatic and fastest recoveries have occurred in babies and young children with severe constipation, and among children who, along with intestinal problems, had severe behavioral problems. These included autistic type hypoactivity as well as hyperactivity, and often accompanied by severe and prolonged night terrors. Very often, the behavioral problems and night terrors cleared within 10 days after initiation of the Haas-specific carbohydrate diet. It is interesting to note that in June 1985, the Schizophrenia Association of Great Britain launched a research project to investigate Dr. F.C. Dohen's research concerning a relationship between celiac and schizophrenia. The basis for this project is a strict grain-free, milk-free, low-sugar diet closely related to the specific carbohydrate diet. Meanwhile, in research laboratories throughout the world, investigators have been studying intestinal problems. Physicians and researchers have found that a special type of synthetic diet, chemical nutrients assembled in the laboratory, called the elemental diet, shows great promise in the treatment of digestive and intestinal problems of all types. The malabsorption problem seen in cystic fibrosis of the pancreas, as well as diarrhea, which occurs after cancer, chemotherapy, have been overcome by the use of synthetic elemental diet. When used for patients with Crohn's disease, not only did symptoms disappear, but children who had not grown properly for years showed dramatic weight and height gains while on the diet. The level of sodium chloride in the perspiration, the sweat test, which measures the severity of the condition of children with cystic fibrosis of the pancreas, decreased dramatically when these children were given the elemental diet. Over 600 scientific publications have appeared in medical journals in the 1970s and early 1980s, testifying to the fact that this elemental diet is effective in correcting malabsorption and reversing the course of many intestinal disorders. However, since the elemental diet is an artificial diet, usually administered via a stomach tube, it cannot be continued indefinitely. When it is discontinued, usually after 6 to 8 weeks, improvement gradually decreases and symptoms usually return. The common denominator underlying the effectiveness of both the natural specific carbohydrate diet and the synthetic elemental diet is the type of carbohydrate which predominates. In the synthetic elemental diet, the principal carbohydrate is the single sugar glucose, which in biochemical circles is also called a monosaccharide. as contrasted with a 2-sugar disaccharide such as sucrose or table sugar, or many sugar polysaccharides such as starch. In the natural specific carbohydrate diet, the carbohydrates are also predominantly single sugars, those found in fruit, honey, properly made yogurt, and certain vegetables. The many research reports indicating that the synthetic elemental diet is beneficial in intestinal disease also supports for the specific carbohydrate which can be used in the home. Those who choose to follow the specific carbohydrate diet need not feel deprived. Many of the delicious recipes in this book could easily be part of any gourmet cookbook. The fact that they are so appealing, however, in no way compromises the underlying specific reasoning. The carbohydrates specified in the recipes are biochemically correct. The specific carbohydrate diet presented in this book is highly nutritious and well balanced. It is safe and very likely to be effective in overcoming many lingering and vexing intestinal and digestive problems.